like to thank you all for coming. As most of you all know, as the region's only level 1 trauma center, it's our mission not only to provide clinical care and clinical services, but also to provide injury prevention services to victims of injury. And as a component of this, I'd like to take the opportunity to thank the mayor, the mayor's office, and the Metro Council for their support in allowing us to expand our programs in violence intervention and expand our services. Their funding and support has helped us provide for additional case workers and community health managers who not only provide emotional support to the families, but also make referrals to some of our community partners and help focus post-hospitalization follow-up care to many victims of violence. And so with that, I'd like to thank Mayor Fischer for his efforts on behalf of gunshot victims and injured victims and his support in these programs, and welcome him here today.
Thank you, Dr. Harbrecht. Appreciate your good work. As everybody knows, public safety is the first responsibility of city government, of any government for that matter, and it's where we invest the majority of our funds every year. About 2/3 of our entire general fund goes into public safety. And when you think about government, we're a service business, and that means we got a lot of people. And as I said, about 70% of our budget is people, and then 2/3 of that is public safety. And the work they do comes in a lot of different forms. Everybody, I think, when they think about public safety, they understand the absolutely essential role that our first responders play, our police, our fire, our emergency service professionals. But you got to go beyond that to just react. An effective public safety strategy requires more than just responding to dangerous situations. It's also about preventing dangerous situations from taking place at the very beginning. And that aspect of public safety involves recognizing the factors that lead up to crime. So that could be systemic issues like poverty, institutional racism, inequities, instability in the home, trauma, lack of access to opportunity to education and employment. So a lot of factors go into this. Now, when our city saw a spike in our homicides about 3 years ago, we were one of many cities in the opioid belt, if you would, that saw this peak in 2015 and 16. What we did then was take a look at our violence prevention strategy and said we need to do more. We consulted with some of our local experts, our national experts, to say, let's take this thing to the next level. That plan built on the public safety work of our Office for Safe and Healthy Neighborhoods that we established in the year 2012. Our plan obviously included enforcement, that is when most people think about the police and the court system, but we also focused on prevention, intervention, reentry, and a couple other areas. That's because we know in so many different cases, threats to public safety can be reduced by ensuring that people in desperate situations have more and better and especially equitable choices for ways to improve their lives. And that, what I mean by that is I got resources in this part of town, the same resources I got in other parts of town. So I'm talking about access to education and employment opportunities, including summer jobs for young people. I'm talking about second chance employment for young people who've been involved with the justice system and want to turn their lives around. I'm talking about basic things like food accessibility, health care, housing, and community centers that keep people off the streets. So we implemented this plan in conjunction with the Louisville Metro Police Department and our Office for Safe and Healthy Neighborhoods, along with a variety of cross-sector community partners. And look at the results. Homicides are down by more than 30%. Shootings are down by more than 30%. Robberies also down about 30%. These are good outcomes. Public safety is moving in the right direction, and our violence prevention efforts were a key factor in making our city safer in both the short and long term. This is something that we should all be proud of together as a city. Now, one of our critical partners is right here at the UofL Trauma Center. And that's because we employ a public health-based system of violence prevention and use models such as the Cure Violence model to organize our work by sending professionals trained in conflict resolution and mediation to connect with victims of violent crime from some of our most troubled neighborhoods, getting ahead of the problem before it starts. Last month, 44 gunshot victims were treated here at U of L through a hospital-based program known as Pivot to Peace. So instead of just going back on the street and potentially back into conflict, these gunshot victims are eligible for case management and support services. And for many of them, it is the moment of truth. You're in the hospital. You got a bullet in you, maybe 10 in you. Your loved ones are around you, and you're going to say, are you going back to that life, or are you going to turn things around? That's what Pivot to Peace is all about. The goal is to reduce injury recidivism leading to death and prevent retaliation crimes and diffuse conflicts in our city. These interrupters work in our neighborhoods, our hospitals, and schools that can stop violence when? Before it happens. Cure Violence is coordinated by our Office for Safe and Healthy Neighborhoods. We adopted it because it's been successful in a variety of cities by taking a scientific approach to stopping the spread of violence. Cure Violence uses strategies and methods associated with disease control. When you think about violence, it's a learned behavior, it's a disease. We want to detect and interrupt conflicts before they start. We want to identify and treat the highest risk individuals, the shooters, the shot callers in our city, and change their social norms and expectations that we can live in a city of peace. This is a key tool to organizing our system of neighborhood-level and hospital-based work. Chief Conrad is doing a great job with LMPD, has stated over the years that we need to do more than just police. We can't arrest our way out of a problem. When you think about safety in a city, it's a co-production of many folks coming together, and of course the police are one part of it. But the Cure Violence approach has been well researched and supported by national organizations like the Centers for Disease Control, the Office of Juvenile Justice and Delinquency Prevention, the Department of Health and Human Services Department, and many more. We've got to treat violence like a disease and focus on the root causes of violence like poverty, affordable housing, employment, access to food, like the 200 families we're helping in Portland through food drives organized as a part of Cure Violence. And now, the reason why we're here today, not just to brag on the results, but we want to emphasize that all of that work, all that progress that we've made in public safety is under threat. That's because of the devastating budget cuts that we'll have to make, primarily because of our pension obligation, because of some changes in assumptions by the Kentucky retirement systems. We've paid our pension bills 100% of the time, but through no fault of our own, this $50 million bill is now at our doorstep, and we're legally required to pay it on time and in full. $50 million is what it maxes out 3 years from now. It's $20 million this year. So when we take a look at the big picture, it's $35 million this next year, $65 million over the next 3 budgets. The cuts obviously are just too big to make without impacting public safety. As I said, 2/3 of our budget is public safety. So what we would have to do is reduce our police force by 250 people, take 3 ambulances off the street, close 4 fire stations, and cut our Cure Violence budget by $500,000. To me, folks, that's unacceptable. We've made too much progress. We're learning too many things. We're saving too many lives to say they just don't matter. Because Cure Violence involves community outreach and public health, to understand the full impact of these cuts, we're going to hear from our Chief of Community Building, Reverend Vincent James, Rashad Abdurrahman, Director of our Office for Safe and Healthy Neighborhoods, and Dr. Sarah Moyer, Director of our Department of Public Health and Wellness. So first up, Vincent James.
Thank you, Mayor Fischer, for your leadership in addressing this budget crisis, primarily because of our pension obligation that's defined by the Kentucky retirement system. We've come a long way in our city as it relates to public safety. And we think about our public safety system since the inception of the Office of Safe and Healthy Neighborhoods in 2012. We've developed a public safety system for the future that's providing us present results. As we think about public safety in the city of Louisville, we're literally on the cutting edge of building a public safety system that upends assumptions and civic structures that hold people back, that allows them and prevents them from achieving their full human potential. Under the leadership of the mayor, our Director of Office of Safety, Health, and Neighborhoods, Rashad Abdul-Rahman, under the leadership of Chief Conrad and Dr. Sarah Moyer at Public Health and Wellness, together collectively with other community partners and community-based organizations, we've been able to do a phenomenal job in addressing this issue of violence in our community and how we could see it as a system and addressing it as a holistic system where we're involving health care and policy, looking at education and business and understanding the criminal justice system and how we can improve that, working with community-based organizations, that as we take in this holistic approach, it has helped us to be able to address a very complex issue. And we've seen significant results. When we talk about this, we talk about it in percentages when we think about 30% reduction in homicides. But when you think about that in reality, that's lives that are being saved. One life is too much to be lost. And we have an opportunity as a city to continue this trend, and the success that we've seen and the reductions that we've seen, much to the work of our community partners and all of the work that has taken place at the University of Louisville through the Office of Safety, Health, and Neighborhoods and Public Health. We know this is a direct result that we're seeing this success as a result of the system that affords us an opportunity to prevent crime before it even happens. With the potential cuts that we are faced with, we recognize that it would be devastating to our city. We acknowledge the fact that when we look at the work that we've done, it's not just work that we pulled out of a hat, but it's research-based, it's evidence-based approaches that drives to the outcomes that we're seeing in our city. And with that work being stopped and that momentum being stopped, we will be set back as a city 10 years. But more importantly, the future generation will miss out. 20 years from now, that will be impacted by the decisions that will be made this coming month. We have the sharpest and brightest minds in the country addressing this issue right here in this city. And to slow or stop the work now is unacceptable. And I want to encourage you as you think about the opportunities that we have as a city to be able to collectively come together and to be able to address this issue together with our Metro Council and with Metro government. We have an opportunity to make a difference of a lifetime. And because of that, I'm excited about the opportunity, but the decision has to be made. And now I want to bring up Rashad Abdul-Rahman, the Director of Office of Safety, Health, and Neighborhoods, who's going to share a little bit more perspective in terms of the public health system that we've developed as we look at public safety and how it's impacting our city in significant ways. Thank you very much.
Good afternoon, everyone. As the mayor, as Chief Conrad, as Chief James just shared with us, we will not police our way to a violence-free community. Full stop. We will not incarcerate our way to a violence-free community. Virtually everyone agrees on that. National organizations like the Center for Disease Control, the Office of Juvenile Justice, Cities United, and more have concluded that cities without a comprehensive approach to reducing violence will not succeed at that goal. We need public health strategies for our city, and the work of this office and the work of our partners behind me has been to define and implement those strategies. It is not sufficient to simply say that we cannot police and incarcerate our way to a safer community. We also have to say, then what is that other thing? What are those other strategies? This is what we're building. We're developing and improving a health-based system of violence prevention for our city that literally is stopping shootings and homicides before they can happen. We must continue investing in approaches that allow us to work further upstream to address the root causes of violence. This isn't some pet project. We are utilizing nationally validated best practice models like Cure Violence to guide and develop our strategies. We are building upon decades of community experience and trusted leaders who understand violence. So when I look behind me at the decades of experience and folks who've been doing this work for so long, this is what we're building upon. We are evaluating our efforts and improving our processes daily. We're talking about 200 families and hundreds of direct contacts happening in the Portland neighborhood. Here at UofL Hospital, as the mayor said, we're talking about 44 patients and their families impacted by gun violence. Again at UofL Hospital, 64 hours spent providing these individuals and families with resources, nearly 200 hours spent engaging patients in the emergency department in January alone. Now is not the time to give in to knee-jerk reactions and pull back. No, we must be bold and courageous if we are going to address a problem as complex and insidious as community violence. Without a question, what you're looking at right now is the future of public safety. Let's protect our future now. It is my honor to now call up Dr. Sarah Moyer, who will also talk a bit more about why violence is a public health issue and how we're doing this work.
Thank you, Rashad. So, good afternoon. I'm Dr. Sarah Moyer. I'm the director of Louisville Metro Department of Public Health and Wellness. And as you've heard, it's really common knowledge that violence is a public health problem. As Mayor Fischer said, this is well documented and supported by national organizations like the Centers for Disease Control and the American Public Health Association. And as a doctor who trained in North Philadelphia, I also have too much firsthand knowledge about violence. I know the desperate, terrified look in the eyes of a teenager as his blood flows from bullet wounds onto my scrubs. I know the sounds of his ribs being harshly cracked open and hands being gently wrapped around his failed heart. And I know a feeling of those hands helping his heart to pump. I can never unknow those things, and I can never unknow the anguish and wails of his family as they are told that all the medicines, the transfusions, the paddles, and the sheer will of dozens of doctors and nurses were not enough to save their son. But also as a doctor and a public health expert, I know how to prevent this. Violent crime is just like an infectious disease. It can spread from person to person, and we know how to stop it from spreading, just like we know how to stop the spread of hepatitis A and the flu. Humans engage in a wide variety of risky behaviors that can lead to serious health problems: smoking, overeating, lack of sleep. It's long been accepted wisdom that doctors should encourage patients to change their risky behavior, give up smoking, go on a diet, exercise, and sleep more. You know that quitting smoking is hard, but it's possible and much more cost-effective than treating cancer. You know that eating more vegetables is possible and more cost-effective than treating diabetes. In the same way, preventing violence through behaviors and system changes is also possible and more cost-effective than treating gunshot wounds. Research tells us that programs like Cure Violence and Pivot to Peace work, and perhaps even better than encouraging people to go on a diet or to quit smoking. Yet the discussion about violence is often underpinned by an assumption that this is a moral failing and that people are engaging in it are beyond redemption. The teenagers I treated in the ER were not beyond redemption. More often than not, solutions to violence have been sought in the criminal justice system through tougher sentencing or increasing stop and search, despite substantial evidence that this is ineffective in reducing crime. When that attitude prevails, people may also look to violent prevention programs such as Cure Violence as a place to cut funds. But the data tells us that we have to treat violence like a disease and focus on the root causes like poverty, affordable housing, employment, and access to food. Because public safety is not limited to just police, fire, and EMS, it requires a multitude of community agencies and organizations working together. Louisville is building a health-based system of violence prevention that focuses on stopping violence at the neighborhood level before it starts and supporting victims of violence in the hospital to ensure that the cycle of violence is broken there. Violence can be prevented and its impact reduced in the same way that public health efforts have prevented and reduced pregnancy-related complications, workplace injuries, infectious diseases, and illnesses resulting from contaminated food and water. The factors that contribute to violent responses, whether they are factors of attitude and behavior or related to larger social, economic, political, and cultural conditions, can be changed. So with that, thank you. And
Thank you, Dr. Moore. Some of y'all might have read some of the articles in the past couple of days in the newspaper about the spread of hepatitis A around our country, and one of the points, or kind of the key point of the article by the Courier Journal, was the failings of the state of Kentucky to properly deal with hepatitis A. Buried within the article were a couple paragraphs describing Louisville's response, led by our Public Health and Wellness Department, recognized as the gold standard for treating hepatitis A outbreak by the Center for Disease Control. I want to honor Dr. Moyer and her team. We have some council members that are saying we don't need a Public Health and Wellness Department. They must not have read that article. Public health and wellness is about saving lives, about putting people back on track in our city, and I couldn't be prouder of the work that our Public Health and Wellness Department is doing. It stands in great contrast to many states in this country. So great job to you and the team with the Hep A outbreak, and then here also with our Pivot to Peace program. Councilwoman Barbara Sexton Smith, Council District 4, much of the challenges that we have in our city when it comes to violent crime and their impact are things that I'm thankful that we have a councilwoman of her capacity to deal with every day, and she's going to share a few words with us as well. Councilwoman?
Thank you, Mayor Fischer. And as we talk about that pension bill that was delivered to us from Frankfurt, it's a bill that we get every year here in Jefferson County, and we have paid our pension bill in full every year. And for the entire history of our local merged government, we have never, not one time, increased our taxes. Not one time has this local merged government increased taxes. So we are confronted with two very difficult options right now. And maybe, just maybe, if everybody will stay in the conversation and come to the table and talk about ways we can work together and solve this complex challenge of this bill that was $10 million more last year, it'll be $20 million more this year, and in the year 2023, our pension bill will be in the neighborhood of $136 million for the 1 year. Our general operating budget is a little more than $600 million right now. So in 2023, look at that huge chunk, that huge bite and big gulp right out of our local budget. So I'm only one of 26 Metro Council members. I want to help folks understand what's happening this week and the next few weeks as it relates to how we're going to move our city forward together. This is not the time to fall back. Oh, no, it's not. Because you can always tell the mark of someone's commitment by what they will do when the going gets tough. Do they sit on the sideline over there without the uniform on? Do they sit over there and point the finger and yell and scream and holler and blame and say, you should, they should, you should? When you hear people doing that, I want you to think about yourself. What are you going to do when the going gets tough? I hope you roll those sleeves up, because Mayor Fischer and his team, they sure have done that. They sharpened every pencil that City Hall owns, and they have put together a proposal that shows each of us how we can participate. And I am only one of 26 members. So on March 14th at the Metro Council budget meeting, that is when we are slated as the budget committee members to vote on this piece of legislation and ordinance, which I am a sponsor of. Now, do you think I'm a shrinking violet? As if a new Metro Councilwoman, I raised my hand and I said, I'll be one of the sponsors of that. That was not an easy decision to make, and I did not make that decision lightly. But I did raise my other hand and say, I will not cut funding for public safety. I will not cut Office of Safe and Healthy Neighborhoods. I will not cut Louisville Fire and Rescue. I will not cut EMS. I will not cut many other services that we have that we all have grown to love and to respect and deserve as citizens in this community. So I want to ask you, when you see your Metro Council person, are you willing to ask them when they tell you they will not vote for this increase in the insurance premium tax? Are you willing to ask them, are you saying that you're going to cut LMPD? Are you saying you're going to cut the Office of Safe and Healthy Neighborhoods? Are you saying, make them answer? Because if they're going to say they won't vote for the tax increase, then ask them what it is they're willing to cut. You got to come to the table, and you have to have some ideas. and you have to have solutions. I believe that maybe, just maybe, in the next few weeks while we're deliberating this, and I invite everybody to please join us for our public meetings. There are more than 20 of them scheduled all over the county. There'll be a number of them in City Hall, which we will be hosting through Chair Bill Hollander of District 9, Chair of the Budget Committee. We need to hear, and we want to hear from everyone.
I'm very thankful for UofL Hospital, too. Ken, Marshall, and the entire team here. If these folks are miracle workers. I've been through those ER doors more times than I'd like to see, but to see the kind of care that's going on in room 9 and throughout the hospital is just incredible. So let's give a big round of applause to our team here at UofL Hospital. Thank you, guys. I also want to say thank you to some of our Cure Violence interrupters. They're here in the crowd that go out and do this work in the city. We're hospital-based here with Pivot to Peace, but then we've got groups that are going out in the city as well, and the skills that they have to making us a more peaceful city, I want to thank them very much as well, along with our team from the Office for Safe and Healthy Neighborhoods over here. It really takes a team to get the kind of results that we are having, and this is really important work that requires highly skilled people. I just want to say a big thank you to everybody. So now, as we look forward, last week Councilwoman Sexton Smith, Council President David James, Bill Hollander, Marcus Winkler, all co-sponsored a bill that would provide a reasonable phased-in increase to our city's insurance premium taxes, going from 5 to 10 to 12.5 to 15%. Pat Mulvihill was part of that as well. We only have one option to get the revenue because we have very limited revenue options from Frankfurt, so it's the insurance premium tax. That it will impact home insurance, life insurance, marine insurance, miscellaneous insurance, but not automobile insurance. We didn't include automobile insurance because we thought it does have a regressive impact on low-income people who are already, unfortunately, paying too much for too many things. Frankfurt severely restricts the options that we do have for raising revenue. The average family would be looking at paying between $12 and $13 a month on their home insurance, for example. It's basically saying, I want to continue to invest in the city and keep the level of services that we have. We've been cutting our budget for 8 years. When we have opportunities to cut and minimize and reorganize, we do that all the time, and we'll continue to do that as well. But the question we got to ask as a city is, what do we want to be? We're always saying we want to grow, we want to be bigger, we want to be better. Getting by on a bare-bones skeleton budget is not the way to do that. We're not talking about investing in new things in the community. We're talking about keeping the current level of services that we have. And I wish this wasn't necessary, but it absolutely is. It's like when somebody rolls into the ER, you probably didn't wish they were in the shape that they were in, but doc, you deal with it. And it's the reality business, just like the bill that we've been handed as well. And our city's got great economic momentum. We need to keep this going. We're a city on the rise, and cities on the rise know how to invest. And closing firehouses and taking police officers off the street, dramatically reducing our effort to cure violence, these are not the signs of a city on the rise. So we believe in the city. Sometimes we've got to fight for the future of our city and invest in the future of our city, and that time is now. So we ask people to study our plan at louisvilleky.gov/budget FY1920 and tell your council member to vote yes on a plan. And for those folks that don't want to vote yes, make them be specific with what their cuts. It's very easy to generalize and say, I don't want to pay any new taxes. Okay, well, I want you then to think about that young man that's rolling into this back room back there that doesn't have these kind of services around them, whether or not he's going to make it or not. Or that firefighter that lives down the street from you. Or that community ministries that's been helping so many people in our community that's now zeroed out in the budget because you don't believe that investing in our community makes sense. We got to get personal on what this means. This is not a spreadsheet exercise. So I want to thank everybody for coming out here today and taking some time to learn more about Cure Violence and the great work that we have here at UofL and with all of our partners, and ask you, please, get engaged as a citizen and let your voice be heard to the Metro Council. God bless you all. Thank you.